past where we get together and talk to people. They do all that online now with their phones. And while that may have a negative in some senses, perhaps we can try and find a way of turning that into a positive. That there could be messages going out through those platforms which would reinforce people's positive mental health, which would do something to reaffirm their value in the world and in life and in general. And I think that's something that needs to be examined. That how can government work with these social media platforms who have got very bad press, and in many cases deservingly so, but there's an opportunity for them to do something to redress that. And I think government should try and engage with them and make progress in respect of that.
Deputy, now we go to solidarity, people before profit. Deputy Gino Kenny sharing with Deputy Mick Barry.
Yes, thanks, Ciaran. Minister, I just want to focus on the 2.5 minutes I have in relation to children and young people in relation to the public health emergency that we've gone through. And it's taken a terrible effect on that kind of cohort. And I think the report this week from Generation Pandemic by the Irish Youth Foundation kind of painted quite a stark picture in relation to disadvantaged children and the pandemic. And one of the aspects of the report was children and young people that have fallen out of the school system and probably fallen out of certain kind of groups that they would have had. And usually when that happens, not all the time, but sometimes they fall into kind of darker forces in society. And them darker forces will educate them, but they'll educate them in a different way and use them, abuse them, and use them for usually criminal enterprises. And that has been obviously kind of compounded by kind of, where young people gravitated towards certain things. That was generally suspended over the pandemic. And social inequality, in my opinion, is one of, if not the greatest detriments to anybody's mental health. If you're living in poor housing and, you're in situations the inequality is compounded, that can be extremely difficult on somebody's well-being and their health. And that's one thing that we need to kind of address. Just in relation to cuts to youth services, since 2010, now it has been addressed over the last couple of years, there's been enormous cuts to youth services. And that has a hugely detrimental effect in relation to communities that had, that engage with young people. And it's important to kind of not malign or alienate young people. We have to kind of be very, very proactive with them and be positive with them, because sometimes it's very negative society sometimes, but young people, are the cause of everything. Because we were all young people at one time, and we all done certain stupid things that we kind of probably regret in our kind of later years. But that's the whole idea about growing up. So it's important that we give the positive aspects about kind of well-being, but the issue around young people that fall through the cracks and fall through all the kind of the systems that they have, that is gone, and that's really important that you address that. Thanks.
Deputy Barry.
Minister, the Leaving Cert exams begin next Wednesday. These are the most stressful set of exams done by second-level students, done by young adults, anywhere in Europe, and I would challenge any deputy in the House to dispute that assertion. It's all the more difficult when you have been forced to prepare for those exams and now sit those exams in a global pandemic. I am certain that there are hundreds of students who are only going to be able to get through the stress of these exams thanks to medication, and I would not be at all surprised if the real figure was in the thousands. That is not the way that young people should be prepared for leaving school and going out into society. The Study Click survey of 2019 polled nearly 3,000 students and found 75% reporting severe stress over the course of the Leaving Cert cycle, with 35% suffering insomnia and 28% depression. I believe that the government decision not to release exam results this year until September the 3rd does not help this situation. It is not conducive to making calm choices regarding college courses. It makes sourcing college accommodation very difficult. and it adds to stress levels in the run-up to the exams. I am not convinced by the government arguments as to why the results cannot be released at an earlier date, and I believe that the government should reconsider their position on this issue. In conclusion, the Leaving Cert is not compatible with the protection of the mental health of our young people. It should go, and it should be replaced instead with a policy of open access to third-level education.
Thank you, Deputy Barry. Deputy Jackie Cahill, please.
Minister, I have a number of mental health issues I would like to bring to your attention today. Some of them unique to my constituency of Tipperary and others on a national level. But first of all, Minister, I want to recognise your work that you put into the Jigsaw project for Tipperary. This is going to be based in my hometown of Thurles. And I suppose since I was first elected to the Dáil in 2016, this is something I've been fighting hard for. And at the time, Minister McEntee was the Minister for Mental Health, and we were told we'd have it in a couple of months. But like the Fair Deal scheme that you introduced to the Dáil a couple of weeks ago, Minister, you have delivered again on this project. And I know you've put an awful lot of work into it, and I really do appreciate that this is going to open in July for referrals. Early intervention is absolutely essential in regard to dealing with mental health, and this Jigsaw project in Tipperary is a cornerstone in building mental health services in my county, and I really appreciate all your work, Minister, and your officials' work in getting it delivered. We had a lot of hiccups along the way. COVID didn't help in meeting targets, but we are there now, and we're looking forward to Jigsaw playing a key part in a mental health strategy in the county of Tipperary. And I suppose, while we have our centre got for Thurles, now, Minister, we'll be looking for the hubs to be opened both in Nina and Clonmel. And, that's an essential part of Jigsaw, that it will be all around Tipperary, which is, a very large inland county. And, we need the hubs in both Clonmel and Nina, so as the services will be readily available to all our young people. And again, Minister, I know you will deliver on this, and I very much look forward to it. And I suppose, the size of my county, Minister, leads me to my next point, and that's the lack of psychiatric beds in Tipperary. We have no psychiatric bed in a county of our size. And, I've spoken on this many times in the Parliament, in the Dáil, and, unfortunately, we're meeting blank with the HSE. And, we're told that there's enough beds in the southeast or the Midwest, depending on whether you're in the north of the county or the south. We're told by the HSE that the ratio of mental health beds for that area is enough. But we have no beds in Tipperary. And, to treat people with mental health issues, to be close to their family is absolutely essential. And for people in the north of the county to have to travel to Ennis, or people in the south of the county to have to travel to Kilkenny, it's just not possible for the interaction that they need with their family to try and get a good outcome for their mental health issues. So, Minister, I would, ask you earnestly to get the HSE to come back and re-examine this. And we're not asking for, a huge number of beds, just that we'd have a small number of psychiatric beds in North Tipperary and in South Tipperary. And if we are going to have a proper mental health service in Tipperary, psychiatric beds has to be the cornerstone of that, Minister. And I would urgently ask you, as you have delivered on Jigsaw for us in Tipperary, that you would be able to deliver a psychiatric bed for us as well. Minister, I just want to, talk about third-level students. And, thankfully, they will be turning to campuses in September, and, the Leaving Cert results will come out in the first week of September, and, they will probably be 2 or 3 weeks later going to university. But they had a very hard time with COVID, and I think, the availability of service to them on campus in this year is going to be extremely important. And, young people, we need to see major investment in mental health support in our third-level institutions right across the country. But speaking to third-level students in my own county, who have spent the last year studying from home and from dealing with student unions, the message is clear. They need far more counselling service on university and third-level campus, especially in-person counselling services. Face-to-face counselling is absolutely essential for these young people. They sacrificed a lot in the pandemic, and and a year and a half, that last year and a half has had a major impact on them, Minister. So I would hope that would be extra resources put into this, Minister, and it will pay dividends. Obviously, it will pay dividends in the long run, and getting in with early intervention for these students could prevent major mental health problems for people into the future. The other people that I'd like to talk about is people who have had financial difficulties through the pandemic. And unfortunately, a lot of people, through no fault of their own, have suffered financial difficulties. And these people are suffering mental health issues. They are under extreme pressure. And I suppose it's to get the message to them, to seek out counselling and seek help. Because, you've had a lot of people who had been very successful, whether it was in the hospitality sector or tourism, or there's many other sectors extremely badly affected, taxi drivers, whatever, the list is endless, on-track bookmakers, the list goes on and on. But these people had their livelihood taken out from under them due to COVID, just no one's fault. But a lot of these people are under huge mental pressure. People who never knew what it was not to have the resources to pay the bills that they're coming in through the door. For the last year and a half, they haven't had any income to meet their outgoings, and it has put a lot of them under huge mental pressure. And to get a message to those people, that there is help there, that there is counselling there, and to go and talk to their local GP and get access to services. And I think that's a very important message to get out there, Minister. And older people, and we talk about loneliness and older people and self-isolation, and it's not just confined to rural areas. Unfortunately, you have the same in urban areas as well. And the pandemic has really, compounded that loneliness for an awful lot of people. And our older people, need access to services and need help as well, Minister. And, loneliness is a major issue. And, after cocooning, just to get people into the habit of going to the daycare services again, going out, meeting people. And unfortunately, older people can go into their cells, and, to get them to go back availing of the services that are there for them again is hugely important. And again, Minister, I think there needs to be work done to ensure that, the services we have, the daycare services, all those services that are there for the older people, that we get them out participating in those services again, because, they had a year and a half of sitting at home, and insecurity does set in with a lot of these older people, and to go out again takes an effort, and we need to get them up and doing it again. And those services are so beneficial for them. It needs to be done. And I suppose the lack of the traditional Irish funeral, and the lack of ability to mourn, and unfortunately older people, a lot of them would have lost partners in the last year and a half, and the lack of social interaction has been, and meeting family and friends through that grieving period has also had a huge impact on people, and that will bring its own mental health issues as well. So I suppose, Minister, in conclusion, while you have delivered for Tipperary today and for my hometown of Thurles, and I recognise that, and I welcome it most heartily, we still have a lot of ask in my county of Tipperary. We are very lacking in mental health services in my county. And as I've said many times previously in this House, we need psychiatric beds. We don't want the HEC telling us that we meet the ratio per heads for the Midwest region or for the South East. We want beds in our own county. And Minister, for people to get the best benefit from the mental health services, it's absolutely essential that they're near their own family. That cannot happen in Ennis or Kilkenny for psychiatric patients in Tipperary. So, Minister, I know you will do your best for us in Tipperary, and I do appreciate that, but psychiatric beds is hugely important to us. Thank you.
Thank you very much, Deputy Cahill. We go now to Deputy Claire Curran.
Ara, thank you for your statement here this afternoon, and I want to focus my contribution on the e-mental health hub in Castlerea in my constituency, which replaced the former Rosalie Home, a dementia care home for older people. I raised the funding issue here in the Chamber 3 weeks ago after replies from the HSE to me confirmed that funding for the e-mental health hub in Castlerea was not provided this year. I confirmed this with the mental health services, the head of mental health services, who confirmed to me that funding had been provided last year to recruit 4 staff members. This year, funding was not given either to keep those 4 posts or to fill the remaining posts, and funding at no stage was given for the psychiatry of later life element of the service. Now, I welcome the fact that the Minister has acknowledged that €1.4 million will be allocated for the continued development of the Castlereagh hub, and you say that the release of funding for this is imminent. I really would like to know, when will this funding be made available, and what exactly will this funding cover? I hope you will acknowledge that it's a shame that it's come to this. I think this funding should have been put in place last June. I appreciate works had to be carried out, but I do wonder why provide funding for 4 posts last year, not continue to pay for those posts this year, and not to fund it at all. And we're now into the month of June. You referenced in your contribution a CAMHS Connect service and a CAMHS Day Hospital. You made no reference to the psychiatry of later life. And this is a really key element, given what was lost in relation to the Rosalie home, that saw the older people that call the Rosalie home moved from here to there, different nursing homes across Roscommon and Galway, even though a government commitment was made that those residents would be allowed to see out the rest of their days in that home. That was a really devastating and cruel blow to the people of Castlereagh, to the people that call the Rosalie home, and to their families. And I think added to that blow is the fact that it's been replaced by a service that has not been funded. And we're now talking about 1.4 million a year later, halfway into the year. And I really think there is no excuse. This was hailed as really transformative for mental health, for young people and for older people. Really key demographic in counties like Roscommon, where we do have an older population, and especially key given that sadly dementia is something that is growing. And I would also ask, in relation to the €400,000 that was given for staffing expenditure, as you've referenced last year, why was that not retained this year? I cannot understand it. And I really think it's disappointing that a service that was hailed and opened with great fanfare, I was there at the opening, a fantastic project, really well done. But then when it's not funded, then it's no good. It's no good at all, and it hasn't served people the way it should. Mental health services for young people and for older people are absolutely critical, and they're as much needed in counties like Roscommon and Galway as they are anywhere else. So I would ask if the Minister could please confirm, either in writing or otherwise, when this €1.4 million will be allocated and what it will actually cover. And if she can also tell us about the psychiatry of later life element, which is really, really important, given, as I've said, the loss of the Rosalie home to the people of Castlereagh and to the county of Roscommon. Thank you very much, Ken.
Thank you, Deputy Curran. Deputy Matt Shanahan.
Minister, COVID-19 has wreaked havoc on the psychological well-being of many in our society, and in many cases has been indiscriminate to age, gender or financial standing. We have all had to accept the necessity of business restrictions and lockdowns at the early stages of the pandemic. But the effects of constant isolation, financial pressures, sickness and loss has taken a very significant toll on many of our population. As we try to navigate our way out of this pandemic, the full psychological impacts that have resulted are only starting now to become apparent. Pre-COVID-19, we had an acknowledged deficit in many areas of psychological assessment in this country. One of the most topical remains the psychological assessment of children with early learning disabilities, but sad to say that deficit is now also extending to adult evaluations also. We do not have and never have had adequate psychological and counselling supports in the public system to cater to need, and where they do exist, they do not have the capacity to cater to the more serious psychological problems exhibiting now far more frequently. We have parents trying to access onward learning and disability services who are waiting months and even years for psychological assessments and approval to enter learning disability care pathways. The Department of Children still continues to not recognise private psychological evaluations for learning spectrum disorders, which can be provided within weeks. Instead, we force patients to wait and access the public list, even though waiting times can extend up to 2 years. This is a fundamental deficit that must be challenged and changed radically in this country, given the extraordinary monies we are presently spending in other COVID support areas. Psychiatric services too are at breaking point in the country. In my own city of Waterford, Minister, which you are well aware, the regional hospital UHW, we have no 7-day psychiatric access, no on-call service at weekends, and the only admittance at weekends possible to the psychiatric department is via the emergency department through referral. Even at this, we have no child psychiatry services or beds available at UHW, which requires child patients to transfer to Cork, which adds to the trauma for many parents and children arriving into their local hospital after some psychological event. Staff recruitment and retention in the psychiatric services has long been a problem both in UHW and nationally, and is being exacerbated now by the increased clinical waiting lists, the extended workloads, the lack of available follow-on bed spaces, and the recurring nature of psychiatric illness. In addition, we are seeing significant amounts of anxiety and depression in our older age cohorts who have been forced to isolate away for months on end from family and friends. And indeed, those presently in hospital still suffer restrictions on family visiting time, despite the fact that nearly all hospital staff are now vaccinated. Despite the opportunities of identifying possible infection risk by using antigen testing in hospitals to screen visitor infection, the HSE continue to avoid any implementation of antigen testing which could resolve this issue. This, in my opinion, remains a dark stain on the reputations of many of those charged with leading our national medical response to COVID. We are seeing too a dramatic rise in the number of people who are becoming overwhelmed by financial pressures because of COVID, which are leading to increased anxiety, depression and suicide. There are a significant body of people, most privately or self-employed in this country, who have fallen through the cracks in terms of receiving adequate or any state support to preserve their businesses and occupations, as restrictions force them to cease operations. If ever there was an example of disparity between the public and private sector's pay divide, it is now most clearly evident in the treatment and the situation that many in the private sector find themselves, where their livelihood and their financial reserves have been wiped out. Meanwhile, they look at those of us publicly employed who have suffered no disruption to our income because of COVID. Such inequity does not do much, and it does much to harbour rage, anxiety and challenges self-esteem, which leads to chronic depression and mental trauma. The rise in social media activity too is also creating esteem and addiction issues. The recent evidence of post-traumatic stress being suffered by social media moderators, the rise in online gambling destroying family incomes, the image and body sharing narratives polluting young and vulnerable minds, leading to a lack of self-worth, eating disorders, suicidal ideation, and sometimes suicidal acts. If COVID has taught us anything, Ceann Comhairle, it is the need for people to be with other people. It demonstrates the brittleness of the consumer society that we have been building for many years, which has been leaving so many isolated and alone in its wake. We are not out of COVID yet, but we must begin a new national conversation, one that seeks to enhance life at all stages, that includes all differentiation, that seeks to value that which we had forgotten and which we have only recently rediscovered. The understanding that we are all vulnerable, yet invaluable, that we are all in this together, and that for our society and people to prosper, all must be included, all must be supported. Community must be at the heart of the future political decisions we take as we try to heal and rebuild from COVID-19. And Minister, could I make one further point just in terms of the new public the strategies in terms of releasing from COVID, and that is about resilience. We haven't mentioned resilience anywhere within the back to work schemes in terms of new business improvements, and I think we need to look and build a resilience component across all department policies over coming months as we try to frame a narrative to leave this pandemic behind us.
Thank you very much, Deputy Shanahan. Now we go to Deputy Colin Burke, sharing time with Deputy Stephen Matthews.
Thank you very much, Ceann Comhairle, and thank you, Minister, for the work that, and to your department for the work that has been done in dealing with the whole challenges that are there with mental health services. And I think it's important that we would pay tribute to all of the staff in all our facilities right across the country for their dedication and commitment, in particular during a very difficult time as a result of COVID-19 and their ongoing work in dealing with the new demands. I think it's important to highlight that we are coming from a situation that say, from the period 2012 to 2020, the budget for mental health increased by 46%. So it shows where we were coming from was a very low base. And we have a lot of work still to be done in this area. I know that the number of people working in this area has increased. Whole-time equivalents now is over 10,400, but it needs those supports and the increase in staff needs to continue. In particular, dealing with young people, I know the CAMS program is extremely important, but it's also about having a team, and it's about a team effort. And if there's one part of that team missing, then it's not necessary, it's very difficult to operate. And I think it's important that we do have a full, in my own area in Cork, with a situation where we had one element of a CAMS team missing, and there were young people were not able to get access to the care that they needed. I think it's interesting to look at, if you go back to 2018, 2019, there were 3 or 4 facilities which were identified which needed major challenges. It was identified by the Mental Health Commission, St. Lomans in Mullingar, Drogheda facility in Carrigmore in Cork. And what I find disappointing is that in relation to Carrigmore and Cork, on the 1st of May, there was a district court hearing where the HSC are now challenging the Mental Health Commission requirements. And I think it's wrong that we are now spending money in court, in a court process, where Mental Health Commission are setting out clear set of advices about what needs to be done, and instead we're ending up where there's a challenge to it. And I think it's wrong that taxpayers' money is being used in this way. I think the important thing, there's 18 patients in this facility, it's outdated, and it's about trying to find a solution rather than going through a whole court process. And I would ask you, Minister, that issue would be immediately taken on board to make sure that all facilities are brought up to standards required. I remember, I know during the pandemic, I know of a facility where there were 27 patients, and this wasn't in Cork, where because the residents there were 6 residents per room, 9 of the 27 people died in a 2-week time period. And that had a huge challenge both for the staff and management and everyone involved, but because it's a facility which is out of date. And I think it's important now that we prioritise updating the facilities, and we prioritise making sure that staff, we have adequate number of staff, but also that they have adequate facilities to work in. Finally, can I just ask, Minister, and this is in relation to people who are working generally in the HSE, we need to put in place additional supports, because a lot of staff working across the entire hospital sector have had a very difficult time over the last 18 months. We need additional supports for them to make sure that we do not have people having to opt out of the healthcare system because they do not have the adequate supports that they need in dealing with the many difficulties they had during COVID-19. And I'd ask that would also be taken on board. But again, thank you, Minister. Thank you to your staff and to everyone working in the healthcare area for their work over the last number of months.
Thank you, Deputy Burke.
Thanks, Anita.
Deputy Matthews.
Thank you, Ceann Comhairle. Minister, I was contacted by a GP in Wicklow a number of months ago who wanted to let me know about the difficulties that she was experiencing in trying to refer patients for services, for mental health services. And following that contact, I organised a group of GPs in Wicklow, a representative group, and met with them. And across the board, for every one of those GPs, they all expressed the same concerns to me on the availability of psychiatry services and psychology services in Wicklow. And across the cohort of services for adults, services for children, and services for people with intellectual disabilities. And each one of them spoke about referring patients that had come into them, children, adults, across that group that I described, and that referral not being seen, or there been massive delays, or that patient coming back to their surgery with a condition that had worsened, having not been seen. And that was really worrying for them, and as doctors you can understand that, and they're limited in what they can do and refer people to those services. So I'm aware that this situation predates COVID, and it predates your time as minister, so I'm not blaming you on this, Minister, but it is a very serious situation. And I have no doubt that during the last 18 months, there has been more pressure put on those services, there's been more pressure put on GPs, there's been more pressure, huge pressure across every aspect of the HSE. And there's obviously been an increase. And I've listened to the other deputies here relay their stories from their constituencies today, and I can see this is across the country. And that was one of the questions that I asked the GPs at that meeting. Is this a systemic failure, or is this just a failure within Wicklow, do they think? They didn't know the answer to that, and I was wondering, is it just across that community health office 6 and 7 for Wicklow? And I contacted your department on that. And Minister, I acknowledge that you and I have had a number of conversations on this, and I also acknowledge that your office was putting together a comprehensive report back to me on the queries I'd raised in relation to Wicklow, and because of the cyber attack and the difficulties experienced there. So I totally accept that, and I want to thank you for the time you've given me on that, and I look forward to that report. I look forward to being able to go back to the GPs in Wicklow to say that Minister Mary Butler is on top of it. She knows what needs to be done here, and I understand that you've met a number of and had a number of meetings. And I look forward to be able to go back and say there is a solution to this, whether that's a recruitment across psychiatric and psychology services, to clear that backlog that's there, and then to have a system that functions properly, that people will go in and be seen in a timely manner. Because as we know, with every medical condition, whether mental health or physical health, it's timely interventions, it's early interventions that give you the better outcome. And the longer you leave something run, as people are experiencing on these very long waiting lists, the less likely there's going to be a good outcome from it. So I thank you, Minister, and I wish you luck with your work. And if you could also pass on my thanks and gratitude to all your staff in the HSE for the work they've done over the last 18 months. Thank you, Conor.
Thank you, Deputy Matthews. Now we're going to the Rural Independent Group. Deputy Carol Nolan is sharing with Deputy Richard O'Donoghue. Deputy O'Donoghue first.
The HSE published a vision for change in 2006 for immediate implementation. Unfortunately, most of it was never implemented. The new Sharing a Vision launched in May of this year reads very well. The key priorities that emerged out of this review were to prioritise mental health in Ireland as a major issue in society, the importance of primary prevention and positive mental health, a requirement to focus on social inclusion and recovery, expansion of mental health services to address the spectrum of conditions and needs, development of government in financing to include research, evaluation and quality assurance. Can the Minister tell me here and now, after two major reports, exactly what has changed? I've spoken to so many people who have said that there is no crisis point for people to contact. However, when I investigated it further, I found that there is a crisis nurse that works from 4 p.m. to 4 a.m. manned by one person. There are less than 50 acute beds in a city the size of Limerick. This is generally full and is a one-unit area. This means that there is a huge mix of groups within the cohort of patients. The unit should be broken down into 20-bed units where we need 24-hour health community teams that work weekends as a backup to the crisis team. This means a 24-hour crisis unit fully operational. Today, I would particularly like to pay tribute to our volunteers that work on Limerick Suicide Watch and Limerick Rescue, that have been involved in interventions and incidents that increased by 30% in 2 years. They do so much work in Limerick. Human rights treaties recognise the rights of everyone to the highest attainable standards of physical and mental health. At the core of Ireland's human rights treaty comments is a range of commitments, is a range of principles that underpin the fulfilment of a civil and political, social and economic rights for all people. And this is an extract from Share a Vision. Minister, can you say this is what's happening in Ireland today? I don't think so, Minister, because as we have seen from this report, there's been 2 reports done on this, and it has not ever been implemented. I have great faith in you, Minister, and I do hope that this will be implemented in its full entirety soon. Thank you.
Thank you. Deputy Nolan.
Good, Conor. Minister, I do want to acknowledge some of the good work that you have done to date. It certainly needs to be said here and put on the record. But it is worrying that we have such a deep crisis in mental health that affects people of all ages in our state. I know that mental health reform have expressed concerns at the low priority given to mental health in the Sláinte Care Implementation and Action Plan, which was just launched on the 12th of May of this year. There's also concern, and I know I've said it before, in terms of the budget being allocated to mental health, this year's budget being just 5.2%. We're facing a major crisis, a deeper crisis, I think, than we realise. And were it not for the fantastic work done by so many organisations who are trying to plug the gap left by the HSE, and the HSE services, we have to get them up to standard. They're just really lacking and of a very poor standard. There's not enough mental health services government are run through the HSE, and we need to make sure that we see more government initiatives in that regard. But I do want to mention the fact that Jigsaw are fantastic, and also accessible counselling, a new counselling service in Tullamore in my own constituency in Offaly, run by and developed by James O'Connor, who was one of the community heroes chosen by AXA, one of just 5 people, an outstanding achievement, and certainly that service is doing fantastic work. But were it not for these great community leaders, we would be in an even worse state than we are at present. I'm very concerned in terms of people self-harming. I know I put parliamentary questions into the Minister for Justice, and I was absolutely shocked to learn that over 14,000 people have been engaging in self-harm or harming others due to mental illness since 2018. I mean, that's a shocking figure. In 2020, the figure was 5,750, I believe. So, I mean, it just shows the scale of the problem we're facing here. And I really think that rather than let it get into a worse state, we do need to now put measures in place, and certainly funding has to be increased. We have to see the HSE rolling out better services and more psychologists and psychiatrists available to people, because it is serious. And look, as I say, I'll end on a positive note. There's great community people and great community spirit, and our GA clubs also are playing a role in that throughout the country. Our
next contributors are Deputy Thomas Pringle, sharing with some colleagues perhaps.
Yeah, sharing with Deputy Connolly for taking about 2 minutes or so. Conor, thanks for the opportunity to contribute today to these important statements. And many of you may be familiar with Charlie McKee's quote and image, "What's the bravest thing you've ever asked the boy? Help, said the horse." The line is from the oft-shared, quoted, and COVID Times bestseller, "The Boy, the Mole, the Fox and the Horse." I think some government ministers, unfortunately, are partial to seeing these types of quotes, blissfully unaware, apparently, of the actual power the government has to expand access to mental health services. You have to have a medical card to access free counselling, and since the cyber attack, people have been unable to apply for medical cards. My office has been on to the primary care reimbursement service regularly since the attack for updates. And this week we were informed that emails are still down, so there are limited services available. PCRS staff can't see the status of cards, and they don't have any indication of when this is going to be accessible again. Now, this morning I did mention this on questions of provincial legislation. I raised this issue with the Taoiseach and welcome his confirmation that GPs can apply for medical cards to be renewed through their offices. He did say, though, that it's not something we would encourage, but admitted that this is exceptional times. The Taoiseach said that he would raise the matter with Minister Donnelly and that a circular would be sent around to GPs to remind them that this can happen, because many GPs don't even actually know that they can do this. So does there need to be a communications campaign around that? That's what would be interesting to know. I know GPs are overworked, but we have to ensure blockages in the process are cleared. My office was advised that relating to emergency medical cards, your GP can do them through their system. Medical card numbers aren't issued, systems are down, but you will get a confirmation phone call. Those lucky enough to already have access to counselling sessions, in some cases have had them cancelled or moved to Zoom. Online counselling might be great if you are privileged enough to have access to the internet and a private space to talk at home. But what about the people who don't have somewhere to go? They don't have a laptop or a room in which to speak freely. Yes, there is a free and confidential text number, which is a welcome addition to mental health services, but are we looking at the data for that number and what is happening in relation to it? How many texts are coming in? Is there a follow-up then for people contacting the text line? And what if that person needs to be referred on to further services? Jan, the country went from we're all in this together to finger wagging and curtain twitching, pushing blame on each other instead of looking back at the failures of the state. Failures to implement affordable, timely and non-judgmental support, access to all who need them in times of crisis and in times of building resilience as well. Thank you.
Thank you. I think I just have a minute or two. I think I stole time off my colleague. I didn't mean to. I only wanted a minute. Yeah, thank you, Deputy Pringle. Just, Minister, I'm only raising one specific issue, and it's to do with psychologists and a new panel, and it has arisen because of the changes in the panel system and because of the cyber attack, both together. And we have no other way of raising this. We've tried bringing it to the Minister's attention, but the emails are actually being rejected. Again, so that's the reason I'm using this time, but it's directly related to mental health. So according to the Health Executive website, all existing panels for psychologist staff will expire on the go-live date of the panel created on foot of the new recruitment campaign. And this is a considerable change to the panel system that was there. Panels existed in theory for a year, but very often they were extended for 3 years. The issue is that the people on the existing panel have not been notified of this change. And of course, the health executive are saying that cyber attack is the reason for not notifying people. As a result, many people on existing panels, many psychologists do not know that they need to apply again for the new panel. And this is the point. It is time sensitive, as the deadline for applications for the new panel is next Tuesday, the 8th of June. Furthermore, due to the cyber attack, only hard copies of applications will be accepted. So people are doubly disadvantaged in that they need to get a hard copy application into the post. It's extremely challenging. We know that it's been an extremely challenging year for all healthcare workers. And of course, we need more and more psychologists. And really, I'm asking you, I don't need to tell you this, we need to be supporting them rather than causing extra. So I'm asking, will you ensure that the existing panels are made aware in the first instance, those psychologists on that panel as to what's happening and that they need to reply, and are considered delaying the deadline to allow them to sufficient time to make applications. And of course, at some stage, if you could clarify why the panel system changed.
Táhachtach seo mar gheall meabhart láinte bhfuil Covid-19 agus tá éis sin críoch le na rátaise sin inis agus comid raig go dtí an céad píosa ganál eile idir a fiche ceathair rátais maidir le cóiríocht don lucht siúl. Comid feitheamh ara. Are you dealing with this, Minister? Tá an taire Peadar de Búrca testáil